Hello, everyone. Thank you for joining today's eLotus webinar. My name is Myra Chen, and I'm your host and moderator. Here at eLotus, we have been hosting educational courses for over 3 decades and are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Let me introduce our new speaker, Ming-Jun Liu. Dr. Liu was born into a family of martial arts and medicine, where he began practicing martial arts at age 4 and studying Oriental medicine with his grandfather at age 10. Immersed in such a background, Dr. Liu brings a unique perspective to his practice, complemented by his expertise in face reading, feng shui, plum blossom numerology, and various other disciplines. Today's webinar is TCM Tongue Diagnosis of Common Respiratory Diseases, sponsored by Evergreen Herbs. Today, Dr. Liu will share his expertise on his tongue diagnostic system, explaining the relationship between the tongue and the body as a whole. If you are interested in tongue reading, we also highly recommend checking out Rick Bernard's palmistry, Aaron Zizov's Baji reading, David Hartman's numerology, Beijing Man's sublingual tongue diagnosis, and Hung-Wei Chang's palm diagnosis. We are so excited to have you here with us today. Please set your chat from host and panelists to everyone. That way, everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box. The quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now let's get started and welcome Ming-Jun Liu.
Hi everyone, I'm Dr. Ming-Jun, founder of the Tongue and the traditional Chinese medicine practitioner. I'm also a professor at Faculty University and mentor doctoral students in traditional Chinese medicine and herb medicine. Okay, let me briefly introduce myself. I've been studying martial arts and Oriental medicine since a young age, so I'm especially good at Oriental medicine diagnosis, include tongue, face, hand, ear, and pose diagnosis. In terms of treatment, I mainly use acupuncture, bleeding therapy, and herb medicine. Okay, due to my background in martial arts, I incorporate various martial arts and qigong techniques to help patients improve their physical health and strengthen their internal organs. Additionally, I'm a professional in fortune telling and feng shui, so I use methods such as plum blossom divination, the Wenwang Gua, and the Qi Men Dun Jia system for prediction, as well as hand reading and face reading to assess future fortunes. Moreover, I analyze the destiny using the Bazi and the Zui Dushu system. Okay, the diagnosis system of Oriental medicine includes many methods, and the tongue diagnosis is just one of them. Learning tongue diagnosis are very clear advantages. So first, it helps us understanding the 8 principles of diagnosis in Oriental medicine, the yin and yang, exterior and the interior, deficiency and the excess, cold and heat. So after you study my diagnosis system, you will have the ability to treat the patient using herb medicine and the acupuncture. Also, among all the diagnostic systems, include face, ear, hand, feet, the tongue is the only one inside. The tongue is the only one inside in the body. So that's why it's the most direct way to show the condition of internal organs So in my clinical experience, I have noticed that as people's living standards improve, so plastic surgery and makeup are becoming increasingly common. So it's not just a girl, even guys and enjoying. So this trend can cover up many signals on the face, hands, and ears. So, however, the tongue remains. What? Okay, because my I see the screen. Okay, so however, the tongue remains inside the mouth. So even though some people clean their tongues with the brushes, so we can still diagnose my disease clearly, many disease clearly. So during the treatment, so whether it's acupuncture or herb medicine, so changes in the tongue can occur within a minute. So this help quickly assess whether the treatment is effective or not. Okay, so traditional the tongue diagnosis is not easy to understand. So therefore, in my loose tongue diagnosis system, I incorporated the holographic correspondence and the 5 elements interactions of internal organs. So it's simple and easy to learn. Both beginners without any period knowledge of Chinese medicine or experienced doctors can quickly learn how to use the diagnosis the patients. Okay, so currently I'm teaching the diagnostic aspect of tongue examination. So, and a clear diagnosis can help you get more trust from patients. Okay, so building on my loose tongue diagnosis, I also have a corresponding system for acupuncture and herb treatment. By observing the tongue, you can determine where to adjust which acupuncture point to use, so or which herb of or the formula to prescribe. So it's very flexible and practical. Okay, so this is a patient with acute like correspondence and gallbladder stone. So as well as the other issues such as like mastitis. So before and after acupuncture treatment, there's a 20 minutes comparison. So this is before the acupuncture, this is after. So you don't need the patient to tell you where the problem is. And often the patient themselves may not be fully aware of their own physical condition. So however, once you've learned the loose tongue diagnosis method, so you can make the quickly diagnosis within 3 seconds. So by comparing two tongue images, so you can see significant difference in the tongue size and the volume and shape. So as the tongue image changes, all pain and inflammation symptoms disappear. Okay, let's explain. So what parts you primarily look for in tongue diagnosis? So when examining the anatomical diagrams of tongue, so the most important aspect of tongue diagnosis is observing changes in the lingua papillae, include their shape, color, size, and this one, and the distribution. So the majority of the tongue surface area that we can observe in covered by filiform papillae, and this the surface area is filiform papillae. So they are less visible on the sides of the tongue, where there are typically some folate papillae distribute near the back, so about around here. The tongue coating is essentially the basic manifestation of filiform papillae. And the fungiform papillae are the largest papillae on the surface of the tongue. Many of the blood stagnation spots and the inflammation spots we can see are most formed by swelling and the fungiform papillae. So this is in this surface. So I will show you next. And the circumvallate papillae are located at the back of the tongue, located back around here. So, and they are generally not visible. So when staying out of the tongue, so if you can see them, it's usually due to the swelling or inflammation, indicating issues related to external factors and swelling. Okay, so looking at this picture, you can see that the filiform papillae and the fungiform papillae are usually flat and tender. So it's flat and tender. So, but if there's inflammation or obstruction in the circulation of a certain organ, swollen fungiform papillae will immediately appear in the corresponding area. So we can see this picture. So this is the fungiform papillae. This is the filiform papillae. They're both on surface. But if we can see this, if swollen, it means like inflammation. Okay, so they might be red, pink, or black. So indicating the severity and the stage of inflammation. In this tongue image, we can see that white coating on the surface. Okay, do a little bigger. Okay, this is one of the patient's tongue. So in this tongue image, we can see is white coating on the surface. So which is a manifestation of the filiform papillae. So overall, they appear larger and flatter. Can do bigger. With a white color indicating extensive cold and dampness. So white is more cold. Okay, a dictionary. So we can see the circumvallate papillae in this area. Can you see that? Okay, here. This is the circumvallate the papillae. So indicating significant gynecological information. Here a little bit too. Yeah. And there are also many irregular shape. Okay. So there are also many irregular shaped papillae nearby. A lot of the irregular. Okay, indicating the poor liver and the gallbladder metabolism. So spatial, when you see here, it's not smooth and like this tongue. and we can see a lot of the irregular shape like this, and sometimes like a swirl like this. That means the liver and the gallbladder metabolism is unbalanced. So moreover, there are numerous fungiform papillae scattered across the tongue. Okay. So we can see here. This is a fungiform papillae, so it's information. So we can call it information point. Very easy. So whatever wherever you can see this part, can see this the papillae, the information point, that means this part have information. So she has a lot of information here. So all here, and include here too, the liver and the gallbladder. Okay. Okay, so after learning the tongue diagnosis, you will be able to make very accurate judgment. So it's more direct, fast, and more accurate than any instruments diagnosis. So, okay, now that we know which specific details to look for on the tongue, so we understand that to diagnosis tongue through photos. So we need the know the okay. So we need the lighting to be natural. So when we check the photo, the light shouldn't be not too bright or too dark. So because it directly affects determine cold and heat the condition. So also over the blurry photos make it hard to check details. For example, in this photo, so we can't clearly see the tongue color or specific information points. It's hard to check. So, however, after learning my tongue diagnosis course, so we can still gather a lot of the information from tongue size and shape in this photo. Okay, so additionally, biting the tongue affects our ability to see the back of the back part and can disrupt blood circulation, so affecting tongue color judgment. So we ask patients to relax and gently stick out their tongue while keeping their mouths open. So it is crucial to remain related and not like excur too much for. So aiming for a clear view of the tip and the tongue of the back and the back of the tongue here. So the whole tongue. So at the same time, we try avoid drinking some like coffee that could stain like coffee, like coffee. Yeah, before examining the tongue, this is because the presence of such staining can interfere with distinguishing between illness and the effects of medication.